I want to welcome everyone to the Senate Budget Committee today. Our hearing is titled, Putting Healthcare Spending on a Sustainable Path. We'll be focusing on possible further reforms to the nation's healthcare system. We are delighted to have three outstanding witnesses here today. They're Dr. David Cutler, Professor of Economics at Harvard University, Dr. Len Nichols, Professor of Health Policy and Director of the Center for Health Policy Research and Ethics at George Mason University, and James Capretta, Fellow at the Ethics and Public Policy Center. I'd note that Mr. Capretta worked as a staff member on the Budget Committee with Senator Domenici. And Senator Domenici is somebody that I'm still in frequent contact with, so especially good to have you here, Mr. Capretta. Although the health care reform law adopted in 2010, I believe, made progress in changing health care incentives and bending the cost curve on health care, rising health costs remain the single largest factor contributing to the nation's long-term fiscal imbalance. So it is the 800-pound gorilla. We believe we need to build on reforms already in place and find further savings in health care. As we build a budget for the next 10 years, it is essential that we find additional savings in every part of the budget. I even had the Secretary of Defense here yesterday and the Chairman of the Joint Chiefs and talked to them about the same requirements. Every part of the budget has to be scrubbed when you are borrowing 40 cents of every dollar that you spend. According to the Congressional Budget Office, Medicare, Medicaid, and other federal health care spending could grow to more than 13% of GDP by 2050. It is important to remember that rising health care costs are a problem in the private sector as well. Let's keep that chart up if we can for a minute, because I really want to focus our attention. In 1980, these elements of the budget were less than 2% of GDP. In 2010, tripled, up to 6%. And it's going to double again by 2050 on the current trend line. Now, what's absolutely imperative for all of us, for the private sector, for the federal government, for state government, for local government, for our families, is that we don't let this trend line develop or continue. It's already developed. I know some of my Republican colleagues have called for repealing the health care reform enacted in 2010. I believe that would be a mistake. It would take us, I believe, in the wrong direction. Reversing health care reform would be costly. Here's what the Congressional Budget Office concluded when it examined a Republican proposal last year to repeal health care reform. CBO estimates, and I'm quoting from them, the Congressional Budget Office, it's nonpartisan, estimates that enacting health care repeal would increase federal deficits in the decade after 2019 by an amount that is equal in the broad range around 0.5% of gross domestic product. For the decade beginning after 2021, the effect of health care repeal on federal deficits as a share of the economy would probably be somewhat larger, they say, and would probably continue to increase budget deficits relative to those under current law in subsequent decades. Just to clarify, 0.5% of GDP in the second decade equals roughly $1.3 trillion. So anybody that's talking about repealing health care reform is talking about adding, according to the Congressional Budget Office, about $1.3 trillion to the debt. One of the most important aspects of the 2010 health care reform is that it laid the foundation for even more long-term health care savings by including critical delivery system reforms. These are reforms designed to reward quality instead of the quantity of care. They included accountable care organizations, primary care payment bonuses, readmissions, hospital value-based purchasing, comparative effectiveness research, a CMS Innovation Center, an independent payment advisory board, and payment bundling. By the way, I was in all the hearings in the Finance Committee, all the hearings in this committee. Virtually every idea brought to those bodies by analysts from whatever political persuasion were put into health care reform. Senator Gregg, the ranking Republican on this committee, and I wrote a letter to the Congressional Budget Office and asked them, what are the things that could be done that would give us the biggest bang for the buck in controlling health care costs? The response that we received from Congressional Budget Office went into significant detail with respect to things that could help hold down exploding health care costs. We put virtually every one of those ideas into health care reform legislation. Despite these positive aspects of health care reform, many of my Republican colleagues remain determined to dismantle that legislation and, I believe, undo progress that's being made. Let's remember the key elements of last year's House Republican plan for health care. They would fundamentally end Medicare as we know it, replacing the program with a voucher system and reopening the prescription drug donut hole. That means seniors would pay more for their prescription drugs. They would block grant Medicaid, which would shift costs onto seniors, children, the disabled, and states. This would also end the counter-cyclical nature of the program, which protects individuals and the economy when we face an economic downturn. They would also defund health care reform, eliminating the new exchanges, the affordability tax credits, and the expanded coverage. This would increase the number of uninsured by at least 34 million people. There may be some evidence health care reform is having an impact on slowing Medicare spending already, although most of health care reform has not yet been implemented. Here's what former Office of Management and Budget Director Peter Orszag wrote last summer in a Bloomberg column. And now for some good news, he wrote. Medicare spending growth has been slowing noticeably. So far this fiscal year, expenditures have actually declined slightly, according to the Congressional Budget Office. We don't yet have enough data to tell for sure what's causing the recent deceleration in Medicare spending or whether it will last. But some evidence suggests it may be a shift toward value in the health care sector. Various hospital executives have told me they've already begun to prepare for less generous reimbursements from Medicare as the new federal health care reform law takes effect and there is a greater focus on value. They are therefore trying to become more efficient now. If Dr. Orszag is right, that would be a positive sign for the budget and health care outlook. However, it is still clear we're going to need to find additional health care savings. Look, I've been here 25 years, and over I've heard, hopeful sounds about health care. And over we've been disappointed. So I just say, count me as a skeptic with respect to us having turned the corner. I do believe, I am not a skeptic about things that were put in the health care reform legislation to attempt to slow down rising health care costs. There are a whole series of experiments in that legislation, again, ideas that were brought to us from every point on the political spectrum, from the most conservative to the most progressive. By the way, the number one thing that Senator Gregg and I were told from the Congressional Budget Office in our request for what would get us the biggest bang for the buck in slowing down health care cost explosion, number one recommendation, and by the way, the number one recommendation of analysts from the most conservative to the most progressive, was change the tax treatment of health care. It was the #1 recommendation of CBO. It was the #1 recommendation of analysts, again, from every political perspective. You got to change the tax treatment of health care because you are encouraging overutilization. The second thing they told us, you got to change the way you pay for health care because you're paying for procedures. And when you do that, obviously you incentivize procedures, whether they are helping people become healthier or not. So I think all of us know how difficult this is. This is now 1/6 of the economy of the United States, actually more than 1/6. More than 1/6 of the economy of the United States, and far more than any other country. Here are some possible options for further reforming health care to control costs. I want to be clear, this is not an exhaustive list. We could further transform payment policies in federal health programs. This might include accelerating adoption of bundled payments to providers so that we're not just paying for procedures, expanding accountable care organizations, because all of the evidence before the committees of jurisdiction was the one place that is really working in our system in terms of controlling cost are accountable care organizations, or reforming cost sharing so that purchasers, consumers, have skin in the game. And I know that's controversial, but I personally believe in cost sharing. I had a doctor come to me who had practiced in India, practiced in England, practiced in North Dakota. He said, Senator, the one thing I've learned, consumers have got to have skin in the game. We could further reform health-related tax expenditures. This is what I mentioned earlier. For example, we could modify the tax exclusion for health care or modify the deduction for health savings account and flexible spending account contributions. This is something that the Simpson-Bowles Commission adopted as a centerpiece of their health care reform. We could take further steps to reduce administrative inefficiencies because we know there's way too much money spent in administration. My own brother is a doctor, brother-in-law, doctor, sole practitioner in Richmond, Virginia, 10,000 patients on his rolls. Pretty amazing for a sole practitioner. He had 10 other employees, 5 of them doing nothing but chasing insurance companies. I will share one story with my colleague. My brother-in-law one day called me out of just sheer frustration. He said, Ken, I just got to share with you an experience I just had. I had a patient that needs urgent surgery. I'm not a surgeon. I'm not going to do it. I'm not going to benefit from the surgery being done. My patient is going to benefit. The insurance company refused to pay. I personally called up the insurance company. I was put on hold for 45 minutes. At the end of the 45 minutes, a person came on and said, Doctor, you should not have called this number. You should have called this other phone number. They gave him the number. And at that point, my brother-in-law, who is Italian, very expressive, got fairly agitated because he told them, that's the number I just called. That's how I got you. And again, they denied the procedure. And he had a patient that was in pain. He said there was absolutely no question in a medical sense of the need for this to be done. So there are a lot of frustrations out there in the medical community. And we could further improve health information technology utilization. I note the first 2 bullets on this chart, reforming payment policies and health-related tax expenditures, were described by CBO in a letter to me and former Ranking Member Gregg as the 2 most effective measures that could be adopted to bend the cost curve on health care.